is a 3D approach to complex surgeries. So, my colleague Dr. John and I, when we were looking at postgraduate training a few years ago, and then, of course, decided to do a lot of complicated surgeries, realized that in our experience of doing these surgeries, that the implantation of complicated devices may not be that simple. It looks a lot easier when they are on screen, when they are on YouTube, but actually putting it into application may not be easy when it comes into the human eye. So it does require a little bit of practice, but there is an issue with that too. You may not be able to get these devices as a lot of them are quite expensive, and then to use them multiple times in the wet lab may not be very easy. So we came up with an idea to actually manufacture those devices. Then manufacturing is a very difficult word to use because there's a lot of approval and patenting and so on and so forth. So we found out shapes and devices which can be as close to the original as possible. And that is why we decided to 3D print many of those devices and then implant them into the wet lab and then finally use them into surgical training. So when we looked at wet lab, and some of it was spoken about in the earlier presentations, we looked at 3D printing the actual wet lab. So this is Tempo, which is a three-dimensional, 3D printed simulated eye, which is very similar to what Dr. Gayatri talked about in the SAFE technology developed by Arvind. They did a lot of that in a three-dimensional way by 3D printing it into the actual device and then using it for wet lab training. So we decided to further our thought. We decided if they could do 3D printing of all these structures, I'm sure 3D printing of devices also may not be too hard. So we looked at what we could implant. At that time, we were embarking from trabeculectomy into glaucoma drainage devices. And then we had this one patient with Marfan syndrome with a subluxated lens. We decided to put a capsular tension segment and a ring and realized that it was way harder than it could ever possibly be. If we had had a little bit of exposure and a little bit of training in how to do these things, maybe we could have gotten a little better. So that decided on our next journey, where we decided to actually 3D print and put these devices for practice. So we use a FreeCAD software, which is an open source software, and use resin-based 3D printing. So the models were authored on FreeCAD. It's an open source software. They are 3D printed using a SLA printer, and the material used for this is UV sensitive photopolymer resin. All the designs were uploaded on Thingiverse. If you look at all three, all 3 points that I made, they're all free sources, open sources. So there is actually zero to no cost involved in printing this. The effective cost of what each of these devices would be less than 100 rupees. So they can be printed multiple times, and in one single print, we might even be able to get 4 to 5 pieces of the same device. So then so this is the resin-based model and the 3D printing lab available at our dental facility, which is used to already printing many photopolymers for prosthodontics. So we put them into the 3D printing machine, and it takes about 12 to 14 hours to print many of these, and then they are dried and cut into the various shapes that are required to actually put them in. So if you look at the various devices that we had printed, they're usually geometrical or symmetrical in shape because the closest that we could get were symmetrical structures on the free softwares. The paid softwares, however, can allow you more complex designs. So that could be a limitation of using a free software. And then that is uploaded to to Thingiverse, which is again an open source material. And if you look at our devices, they are they are very simple to print. They are usually either a polyhedral like the BHEX, and this is we got the Sioni and the capsular tension ring and the Ahmed segment to be printed, and the intricacies in design were redrawn and then finally printed out. So when we decided to do the Ahmed glaucoma device, we decided it was a valve structure. In creating a valve could be a lot harder, so we decided to go to the next non-valve structure that we had, which is the Adi. The Adi has a footplate and a polymer like based tubing in the front. So to design and these 3D printing devices, we looked at the possibilities. 3D printing these devices could be very expensive and can be very difficult, and the learning curve is also a lot longer. So to get the actual shape, we decided to use the original dimensions of the implant to get a simulated variant as close as the original that is possible. So we used the open source FreeCAD software to draw many of our devices and then use resin as a polymer to 3D print the device. Once the resin model was made, it was taken to the wet lab, to the 3D lab, and then we printed the actual foot plate with that. Now we needed a tube to be part of the footprint of the plate. So we decided to use the pediatric Venflon, which is very similar in boring to the original device, attached it to the foot plate, and then got the actual foot plate with the tubing in front. The tubing's patency is always checked and made sure that there is no leak or there is no block in any part of the tube. That is very important for the device to actually filter. So that's the first step of doing it, which is called priming. Next, the device is implanted into the conjunctival peritomize section. We put it as close to the original as possible, which is about 10 millimeters to the base. After marking it, once the footplate is tucked inside, it has to be secured and anchored with a 10-0 nylon. Since our footplate is a little larger, we used about 9-0 Prolene. We don't use any kind of vicryl sutures because they might tug off and it cannot be a little difficult to implant. Once that is done, we have to trim the tube and make it a beveled tube so that we can implant it into the anterior chamber. Prior to that, a needle tract is made 4 millimeters away from the limbus, and once the tract is made to reach all the way to the limbus, the anterior chamber is entered, and the actual tube is tucked into the tract to make sure it enters the anterior chamber. So the bevel position becomes very important, and that is why using the pediatric Venflon was very similar to actually using the glaucoma drainage device, where we can put the tube into the anterior chamber. Once that is done, you can see that the tip of the tube is seen beautifully in the anterior chamber. This is the evolution of all the devices that we used over a period of time, and finally arrived at what is closest to what we could actually make. The effective cost of making this entire thing was less than about 100 rupees. And once it was done, we were able to implant the device into the goat side and practice it multiple times before we entered the OT. And trust me, it was easier than actually doing the original surgery because our surgical time was reduced, and the common mistakes and the difficulties people face with using the glaucoma drainage device also became a lot lesser. We also printed the Sioni and the B-Hex ring and used it for many surgeries. So my co-speaker will be talking about the complex surgeries that are present today and how to tackle them. But implanting those devices directly may be very difficult for a beginner. And this is a good way to begin. Just print it and look at the world in a three-dimensional view. Thank you.